Welcome to Bite-Sized Insights, a series of quick, live talks from a range of experts in data science and healthcare. All of these sessions were recorded live at HIMSS 2023. If you want access to the slides we used in this presentation, click the link in the description below.
So what's changing? Historically, there's always been a fee-for-service adjuster, which means that you have a little more wiggle room in that fee-for-service category in your audits, which gave you less you'd have to repay to CMS. And that adjuster is going away. This means that for the years 2011 to 2017, you're still good. Those audit payments will stay. But everything from 2018 forward, it's going to be extrapolated under the new format. Moving forward. So this means that your EHR data and your claim submission by the payer are going to have to match at a level unseen before. Your workflows are going to need to be incredibly tight to make sure these data match. We're going to talk more, Julie will talk more about what that means and how Arcadia can help out. But fundamentally, for any payers who are listening, your margin of error just went away. This means that you are, again, those audit codes are going to be extrapolated. They're not actually going to extrapolate out on the fee-for-service side. It's all going to be the same for VBC and FSFs. So you're going to have to make those codes the same. For providers, the pressure is on. There's going to be intense pressure from your payer organizations and other partners to make sure that your EHR documentation is updated, accurate, and fully capturing the full risk and ICD codes for your population. When you combine this with the new CMS V28 changes that are coming, which is beyond this talk, it means that there's a lot more operational pressure on your teams to get their coding right first time. Julia, you want to talk about workflows?
Absolutely. Hey guys, I'm Julia Kelly. I am our Manager of Application Enablement here. And now that Christine has given us that excellent information about how the industry standards are changing, I am going to talk specifically about how Arcadia is supporting its clients in navigating this nuanced and obviously ever-changing risk adjustment landscape. And the way that we do that is with a tool that we call Assess. It is a workflow-based tool designed to facilitate condition capture, optimization, and clinical documentation improvement. And behind that tool, we have a couple of key value drivers that really are critically responsible for setting our customers up for success on those risk-based contracts. And I think the first and probably most important value driver here is that Assess is highly configurable and highly flexible. We obviously have our own out-of-the-box infrastructure, we have our own best practices, but really the idea here is that we treat our customers as individuals, not as sort of data points. So we understand everybody's going to be coming to us with their own existing workflows, their own unique sets of end users, and specifically organizational KPIs. So first and foremost, any partner working with us is really going to be supported in making sure that their risk adjustment workflows in Arcadia are very closely tailored to what they need out of the application to make them successful. And the second bullet point there for facilitating success is based around Arcadia's automation engine capabilities. So as Christine said, the pressure is on for providers to make sure that, when they're looking at this overwhelming array of data points and information, how do I even know which ones are the most actionable, right? So Arcadia will essentially work with our clients to set criteria in advance around the specific patient populations that you want to target for risk adjustment. That criteria is usually based around variables like contract eligibility, could be around patient to provider attribution and assignment, even a specific array of risk conditions if you want to target a specific set. And the idea is that, again, that automation engine is running in the background, identifying the most actionable and impactable patients, and then surfacing those to care teams, providers, risk coding teams to make sure that they are really getting the most bang for their buck out of their workflow and reducing the sort of extraneous noise. So that's actionable insights as well. And then again, the pressure is on. I'm going to keep saying it because we all know it's true for accuracy and making sure that your data is lining up against sources. And so something that Arcadia has really invested in to support that are our robust auditing and quality control sort of checkpoints and workflows in this Assess application. And what that means is that after users have sort of gone through, done the first pass and entering data, you can empower a sort of a second tier of auditing reviewers who will retroactively review information. And if they do see anything, like typos happen, we all get it, right? We're all human. So maybe someone missed a date of service or they wrote in the wrong provider MPI, they were off by 1 digit. That is not going to sort of just, you don't have to throw that condition out the window. We've made a typo. We don't get credit. You can actually either just flat out reject or correct that information, send it back to the submitting user, and give them the opportunity to edit and resubmit that information in Arcadia. So again, you're not leaving anything on the table, and you can really feel confident using the Arcadia workflow that the data you are putting into our system is coming out and it is accurate wherever you choose to send it on downstream. And I just said send it on downstream. That brings me to my last bullet, supplemental data generation. So again, this is really a tool designed to support user-defined data that is typically sent on, extracted out of our system and then passed along further to support contract-based reporting. So that is something most of our clients take advantage of as well. And then I know I've let the suspense build here. I've talked about this application and not shown anybody what it looks like. So I will close with just a quick snapshot. This is an example of a patient profile in the Assess application. So you'll see that Arcadia is going to surface any risk conditions from our system that we think should be attributed to that patient. And those are risk conditions coming from a couple of different places. So you can see at the top here, probably the most common is going to be information coming in from historical claims that we've aggregated. But we might also be pulling data from an EHR feed, from a problem list, or even our own risk suspecting algorithm that we design in-house. So again, really making sure that the risk conditions that are being surfaced are the most actionable, are attributed to the patient with a supportable evidence, and making sure that users are really getting the opportunity to capture everything that's critical. And when I say capture, you'll see some buttons here. So the idea is that someone would go through, review the risk information. I could confirm or deny a condition, based on whether the suggestion is valid, and then support it with supplemental information. And that might be pieces of information like a provider name or MPI, like I referenced before. Could be a date of service. You could add a free text note to sort of contextualize your action. Or again, to Christine's point about making sure matches are critical. Most of our users, you'll see there's a browse and attach feature will actually screenshot the EHR and attach it to the record. So if you are sending this data on elsewhere, you can say with certainty, this is where I got it. I didn't make it up. It's supported by hard evidence, and we can back that up if we were to get audited. And it's a pretty flexible, accessible workflow, as I said. Obviously, one of the biggest use cases here is for retrospective workflows with risk coding teams, but we definitely have clients using this in clinical settings as well. So providers going through either concurrently or retrospectively, again, making sure that clinical data documentation is optimized, is accurate, and you are getting credit for all of your conditions, not leaving anything on the table, and it's accurate if it's in our system.
All right. Well, thank you so much, Julia. With that, I will open it up to any questions, either about RADV or the ways Arcadia can help with workflows. Yeah, so for anyone on the live stream who didn't quite hear that, the question was, does Arcadia have any tools that would allow for prospective reviews as well? So basically catching gaps before they even need to hit this retrospective or concurrent process. Do you want to talk about the workflow tools, Julia?
Sure, absolutely. And I will say the Assess workflow can be used prospectively, particularly with providers or clinical users. You might have someone go in and prep a form, maybe in anticipation for an annual wellness visit, kind of crosswalk what's already in clinical documentation, and then maybe have someone finish it up. Probably not at the point of care. We have other tools for that we could talk about quickly, but maybe immediately after a visit. And we do have other, not to go on a tangent, but do you want to talk about desktop quickly?
So I'll quickly talk about this. A great companion to Assess is our point of care workflow tools. So what that allows is it lets you surface all of the risk gaps, quality gaps, and other data that's in Arcadia directly onto or within the EHR, depending on your system. What that really lets you do is it lets you take all the data Arcadia knows about this human and bring it to the provider. So it's above and beyond what they have in their native EHR. It's when they broke their leg out of state. It's a acute myocardial event that happened when they were on vacation. It's everything else that we know about them, and everything to what Julia's point that we've suspected through our risk suspecting engine as well, brought forward to the point of care, so they can start to make those close those gaps right then and there. Yeah, of course. So for anyone on the live stream, the question was, how is the impact of these changes to RADV going to affect teams of multiple sizes, right? Whether you're a small provider org with maybe, 5 people in your office max versus a large, national payer system. I think the answer is kind of complex and really is going to boil down to it's a lot of workflow operational changes And the more staff you have and the more experience you have in this area, perhaps you're going to be able to absorb those changes a little bit more. At the same time, your risk is higher, right? The more just sheer claims you have coming into your system, the more money you have on the table. For those smaller teams, though, especially being able to standardize your workflow processes, get them off of paper, off of fax machines, and into the cloud and into a much more streamlined system, I think is really going to be key to success. Julia, do you want to add anything to that?
Yeah, definitely. I'll say as well, I think I opened my section saying assess specifically is highly configurable. And some of our clients are great. They're massive. They've got the infrastructure and the resources to really broaden the patient population and make sure that they're capturing data on, anybody that might be eligible for these programs and these reporting criteria. And then we have other teams that might not have the capacity to have like a full auditing workflow, and they might just decide, you know what, I've got 4 risk-based contracts. Realistically, I can't optimize every single one, but I know that this one has the most lives. I've got the most money on the table for this. So let me tailor the patients in this application to that population so I can at least really double down there and get credit.
All right. Well, thank you everyone for coming and listening. We appreciate your time.
Thank you guys so much. We'll be at the booth. So if you have any questions, feel free to stop by.
Thanks for tuning in to Bite-Sized Insights. Please visit arcadia.io to explore more of these topics, or check out our other podcasts on data science and healthcare.